Yo tengo 26 años. Yo tengo 7 meses de embarazo. Me dijeron que la reacción, cuando yo tengo 7 meses de embarazo, mi cuerpo empieza a rechazar a los bebés. Pues cuando yo llegué de México y pues no, yo no sabía de nada de ninguna clínica y mi hermana me llevó ella a la clínica que ella iba, que era Chicago Family.
Chicago Family Health Center is lucky to call 5 neighborhoods in the south side of Chicago home. There's our central office in the South Chicago neighborhood, in the east side off to the east, Chicago Lawn in the farthest northwest of our service area, and then in the Roseland community where we've been operating for about the last 7 years, and then the Pullman neighborhood.
We started with 3 people on staff, a doctor and a couple of other people, at a small medical center there that we began. And then from there it grew, and especially in the last 10 or 12 years, it's really expanded significantly. When we first opened our doors in 1977, we saw 400 patients. In the past year, we have seen 28,000 patients.
From the time you walk in the front door at one of our facilities to you seeing the physician, using the services in our dental department or behavioral health, each one of our about 200 coworkers is totally committed to making sure that you have a great experience and that you have the best opportunity to be healthy that you can.
There's a whole team of people working together to look after the patients. Physicians working with nurses, working with the medical assistants, the health educators, social work, psychologists, everyone. It's so key for there to be that entire healthcare team taking care of the individuals.
Me gusta mucho cómo me atienden los doctores cuando estoy embarazada o cuando llevo a mis niños a cada revisión.
The reason why Paulina qualified for the program was she had a history of having her babies early, and so she has to come to the hospital to get shots to reduce the chance of her having this last baby early.
I think the biggest challenge is the overwhelming need of the patients. Again, the sense of there's the medical problems that you can deal with within that doctor-patient interaction inside the clinic room, and then there's a whole world outside of the clinic room that hugely impacts the health of the patients.
I'm 34 years old. I'm a mother of 2 now, and before I might not have been able to afford health care. Being able to get the things that you need for your children, education, it's just awesome. I like Pullman. I grew up here, actually. It's a good place to have a family.
Chicago Family went to the Pullman neighborhood in 1987, so just about 25 years ago, when the federal government identified a great need for healthcare services in that neighborhood.
The community went through a huge transformation, and at that point, a lot of the businesses at that time started moving out of the community also. And so when the jobs left, a lot of the financial base of the community also left with that.
So our Pullman location today serves about 6,000 individuals who go there for their health care and dental care. After we build the new facility, we'll be able to take care of more than 16,000 people in the Pullman neighborhood.
That's huge when you talk about good quality healthcare, and I keep emphasizing good quality healthcare because everybody doesn't provide that.
It's also a great opportunity as we expand to a 21,000 square foot building where we'll actually have 23 exam rooms to take care of patients. We'll be expanding our dental practice from just 3 chairs to a total of 9. So we'll be tripling the capacity for people to get dental care in the Pullman community.
We're going to take an entire block and level it and rebuild it. I'm partnering with them on how we can get residents to actually build this building. And so you're empowering your community and you're employing your community because we have a lot of tradespeople in the community also, and that gives the community a sense of pride.
We've always looked at not just the spiritual, but also what the needs of people are. Healthcare is a basic human right. You realize it takes a lot of work and a lot of effort, and many people are involved in this. We need the cooperation of everybody, the federal government, the state, the local community. Everyone has to participate, and we can't leave anyone out.
We need everybody's help to take the next step and make health the attainable goal for so many thousands more.
Because our community is on the rebound, it's really coming up. We have a lot more jobs coming into the area, and the more help we get, the better to help stabilize the community.
A little bit goes a long way providing the resources to take care of disease before it becomes overwhelming disease, when it still is treatable, when you can bring healthcare teams to action to keep patients healthy. It goes so far for the health of the individuals and the health of the community.
If you think of people who are at their lowest point, they'll always say, at least I have my health. And if we can impact on that and give someone the opportunity for health, then we're giving them the opportunity to be anything they want to be.
I love it when patients come in and say, thank you, doctor, you have changed my life so much. And that sense of appreciation and that sense of giving to each other, providing health, and then providing sustenance for myself, it's wonderful.
I want to thank the Chicago Family Health Center for giving me the opportunity to be part of its mission. And I thank it for giving me medical care that I've used for the last 30-some years.
Your support will help my family.
This has really been a journey, and it's one that I don't take lightly. Thank you.
Yo le doy las gracias a Chicago Family Health Center por el atendimiento que me dan a mí, a mis hijos y a mi familia. Pues ellos son muy importantes para mí, son como quien dice, el motor de mi vida.